I'm introducing John Vallee. He is a member of Renaissance, and he's in our mystery book club. He's a mentor in the gerontology program here through our Renaissance program. So he recently retired from 30 years as a Kaiser physician, specializing with women healthcare and emergency procedures. And so with that, I'm just going to give this to him.
Well, thank you very much. I hope you can hear me now. Is this okay? Okay. No? Closer? Is this close enough? Wow. Okay. Very good. Um, so I'm super excited to talk to all of you today. The subject that we're going to be handling is that of gold rush medicine. And first of all, it really is two of my most precious and focused interests, and that is medicine, since I retired as being a physician, and also gold rush and the California history, which I am only a 30-year resident of California, so I came upon this and it has been a truly interesting and fascinating period to learn about. For the last 5 years since my retirement, I have been a docent at the Sacramento Medical History Museum, and I'm hoping that after talking with you for a little while, you all will be as equally excited and happy to go visit there as I am to be able to be a docent there. As a matter of fact, in thinking about those opportunities that Deanna was talking about, tomorrow is the second Saturday. And on second Saturdays in Sacramento at the Sacramento Medical History Museum, we are open for everybody from 10 o'clock in the morning until 4 o'clock in the afternoon. And we have docents that are regularly stationed there who can go over some of the artifacts and some of the stories. And I think that you'll, come away with it with even a deeper understanding of what's going on. All right, so let's go on and start the slideshow. And before we get too far into it, I do want to make a land acknowledgement. And the reason that this is particularly important is that we are going to be studying a time in Sacramento history that was completely disruptive to the Native Americans. For thousands of years prior to the immigrants coming over from Europe and from Asia, there were Native Americans that were on this land. The Nisenan peoples are sort of the general tribe that was located in this particular area. And although that they suffered with terrible injustices throughout history, they still live on today, and they practice their traditions, their culture, and their language. So I want to make an acknowledgement to them. The area that we're going to be talking about today is located on this map here. And as you can see, we'll talk a little bit about the history and kind of what happened. The Sacramento area is really well suited for a number of different things. It is at the junction of the American River and the Sacramento River. And there was a fort that was established back in 1839. This was Sutter's Fort. John Sutter was granted a land grant by the Mexican government, and he put that fort up there at that particular time. That fort was started primarily as an agricultural settlement. It wasn't really a military outpost. And in doing his agricultural things that he was wanting to do, he went ahead and wanted to expand in 1848. In 1848, he sent one of his foremen up to Coloma, and you can see that Coloma is on the South Fork of the Sacramento of the American River, and in the area around Coloma, there were lots of trees and forests, and the idea was that John Sutter needed some additional trees in order to build up his fort a little bit better, and so he sent James Marshall up there, and in January of 1848, James Marshall discovered gold. It was a funny way that he discovered it. He was building a mill, and in the mill, he was some water through it. And then in the trailings of that mill, that's where he found the gold. So he brought that gold down to show John Sutter about that, and they tried to keep it a secret. They thought that they could kind of keep this one all to themselves. But after about 2 days, I think the cat was out of the bag when they brought it to the person, the surveyor, the analyzer, who had to tell how much it was worth. That was the end of it. And from that time on, there was a huge population growth. This was really something, we use the word unprecedented so much these days. Something unprecedented. The population of Sacramento at that time of non-native Americans was less than 100. Okay, that is at 1848 when gold was discovered. 2 years later, there was then over 10,000 people. So you can understand a big, huge population boom. And the early boom, of course, had its problems. Just think about it. People are coming from all over the U.S., they're coming from overseas, they're coming by land, they're coming by sea. And when they arrived in Sacramento, they were not in great shape. They were sometimes very sick, injured. There were all kinds of problems. There was also there were other difficulties with them being in this tight quarters. There we go. Okay. Figure this out. The tech always trips you up. Okay. So here's the slide that kind of explains a little bit about some of the growing pains. So people are coming over, they're in very cramped quarters, and there was, sort of death and disease and other things going on. There was no real separation between sort of their sanitation area and their living and working areas, and that was a problem, as you can imagine. There were physicians that came over. However, the physicians were mostly wanting to get their own gold, and so they weren't they weren't dedicated to the ministering of people right at the beginning. But with time and finding out that they couldn't earn so much money, they did go back to their chosen profession. So I do need to stop and tell you a little bit about some of the challenges of trying to get under some control of these diseases during this time. And you will not be surprised that medicine was very different in the 1850s than it is today. As a matter of fact, they didn't really even understand about the origin of disease. And we'll talk a little bit more about that. But the germ theory and the origin of disease was not even figured out at that time. In addition, there was inadequate infrastructure. There just wasn't enough room or safe places for these people to live and to work and to stay. And then the other thing that was going on was that there were all kinds of people coming into the area that were saying that they were healers and doctors and things like that, but they were not. There were charlatans, there were medicine men, there were traditional Chinese medicine practitioners. And so I guess today some of those people would be called influencers. But at the time, the prevailing word for that was charlatan. So, in spite of all of the confusion and the difficulties and the trouble with public health, there was a group of core physicians that tried to kind of educate the public and to try to make things happen. And so they would often band together so that they would have power in numbers and be able to help each other out and cover for each other, that sort of thing. So during the 1850s to the 1860s and the end of 1860s, there were a multiple number of medical societies that were found and started to do some work. They go by various names and they kind of come and went, but then the aforementioned Sierra Sacramento Valley Medical Society kind of emerged in 1868. And that is actually the same medical society that's here today. That's the one that I belong to, and that's the one that houses the Sacramento Medical History Museum. This is the door to our business offices, and it's located at 5380 Elvis Avenue. It's only a mile and a half from here. We could walk if we wanted to. And in the bottom floor, there are business offices. But there's also over 5,000 square feet of space that's dedicated to our Medical History Museum. And I'd like to just let you know that all the artifacts, the slides, most of the materials that I'm using here on our talk is from the Sacramento Medical History Museum. And if you kind of think about this for a second, so it was formed in 1868. There were physicians that were kind of coming and going and practicing and working and living here in Sacramento. And what would happen to the physician at the end of the career when he had his garage and his attic and his basement all full of junk? They would do what I did. So that was, I grabbed all the stuff that my wife no longer wanted to have in my house, and I brought it to the Sacramento Medical History Museum. And I gave a lot of stuff, most of which Dr. Bob, our curator, said, we can't use this. We can't use this. But there were some things that I was able to offload. So the thing about that, though, is not only is this really stuff that people, physicians in our area used, but it also occurred for such a long period of time. So these artifacts are actual things that patients and physicians both use, and it tells a story. And that's one of the things I've been to the museum. In my docenting, I've been to the museum, probably hundreds of times. But every single time I go, I learn something new because there's a new story, a new artifact, something that I haven't seen or read about before, and it's truly a gem for Sacramento. And I hope that you'll be going there since I've talked about it. The state of medicine, though, in the 1860s was pretty horrible, and I used this photograph. This is a photograph of a painting that we actually have in the Medical History Museum. The painting shows the predominant figure is the one in the center with the light shining. This is a young child, a year old. The child has typhus. Typhus is a very simple infection that we have vaccinations for, and that is easily cured, okay? But this is a physician in the 1860s just sitting there looking and trying to figure out what is he going to do to help this child. In the background, you can barely see, but there is a picture of the painter, the man that's standing up in the background. And on the table in front of him, he has his wife prostrate because she's just so overcome with grief. So the state of medicine wasn't very good in the 1860s. The next slide shows why that was. Well, the reason for it is that they didn't really have a basis of understanding about what caused disease. Um, they were still operating under the theory of the four humors. I don't know if anybody knows these, but we're going to go through them real quickly. So, back in Greek times, Hippocrates, the father of medicine, had an idea that your health had to be balanced because of these four humors that were in our body. And those four humors are listed up there. There's blood, yellow bile, black bile, and phlegm. And this kind of sounds like a weird theory, but at the time this is all they had, and it kind of makes sense because they knew that there was stuff inside people, and there was some of these liquidy things, so that there was blood. We all know that that's inside your circulation. Yellow bile, that's stuff that comes from the upper intestinal tract, GI tract. Black bile is stuff that comes in from the lower part of the GI tract. And then phlegm is all the stuff that's kind of in your nose and mouth and stuff. So what the idea was is that the four humors had to stay in balance. And if it got out of whack, if anything was too much or too little, the physician had to make the diagnosis, figure that out, and then try to let those four humors get back to homeostasis. And so you can see some of the methods that they used to make this happen. Blood, that's where the bloodletting comes from. And the bloodletting, it kind of makes sense. They used to think that having a fever from an infection or something like that, they didn't know it was an infection, but they thought having too much blood led to a fever, so that they would let the blood out. Yellow bile, they have to make you throw up, and black bile, they had to make you have diarrhea, and phlegm, they had to make you spit up. So that was the state of medicine. As you can kind of think in your head, doesn't sound very attractive, and kind of gross and disgusting, and actually maybe harmful. But we have stuff in the Medical History Museum that shows all of this. We have a very nice bleeding treatments case, and you can see on quick glance there's a bunch of things there. I've taken the liberty of photographing each of these separately, and we can talk a little bit about it. Over on that upper left-hand corner, you see something that's called a phlegm. It's PHLEM. The phlegm basically has two parts to it. It's got a horizontal part that's a dull piece of metal, and then it's got this little pointy triangular thing. That's the sharp end. What they would do is they would take that phlegm out. They have different sizes, different size veins. And then they would put it on the skin, they would puncture a hole in the vein, and then they would let out the blood. There's a picture of it right next to it. You can see the physician has the patient on a chair, and he's got a tourniquet around, and he's basically popped a hole in the vein, and the blood's coming out. Below the phlegm, also on the right, my right, your left, you can see a device that looks like sort of like a knife on a stick, and that's what it is. That's a lancet. Some of you may recognize Lancet. It's the name of one of the medical journals, and it was named because of this very device. The Lancet was started back in the late 1700s, and it's retained that name, even though we don't use lancets anymore. Next to it, what does this look like? It looks like a guillotine, and that's what it is. So it's a device that's called a scarification device, and the scarification device, basically there's that little silver thing on the top that you push, and what it does is retracts all those blades under a spring-loaded device. And then on the button on to the right, you go ahead and just push that down, and all the knives kind of come out and cut open the vein. The one next to it is sort of an automatic phlegm. It's got the same sort of architecture as the phlegm I told you about before, but this one is also a spring-loaded device. And then on the top above that, that's my, everybody knows what that is? A leech. Well, leech, so if I had to have bloodletting, I actually would want to have the leech. Do you want to know why? Well, the leech, it was actually the most humane way to get a bloodlet. Um, what would happen? The leech is a fascinating, warm like animal. And what happens with the leech is the leech goes onto your skin and it has basically the ability to inject a little bit of a Novocaine like substance into your arm. Once it does that, then it can go ahead and wrap its mouth parts around your skin, and then it goes ahead and it pierces that, gets into the vein, and then it adds a little bit of a chemical to your bloodstream that has an anticoagulation part in it. And the anticoagulation just lasts long enough for the leech to get all of the blood out. So if I had to have it done, which I don't, that is what I would choose. This is a bleeding bowl, and this is one of the devices that we have this artifact at our medical history museum. You can see it's kind of set up for being used again and again. It's made of brass, and it has a little crook in the edge of it for you to put your arm, and you could snuggle up when you're getting your bloodletting. This bowl is not used anymore. This is just for historical purposes. All right, let's get back to what the physicians were up to. So they formed a society. They kind of had some organization. They gave education. They told people, don't poop where you eat, common sense advice, that sort of thing. And diseases kind of got better, and infrastructure started to take off, and more people could live in a safer environment. The other thing, of course, was to distinguish patients who were trained from everybody else. The society kind of had, expectations about, going to medical school, having worked as a physician for some period of time, those sorts of things. And they also developed a fee schedule. So I bring this one. This is another artifact that we have at the Medical History Museum. And I think it's kind of interesting to look at how much things cost. Sure. The first one is just about routine cases, something else. It's ordinary prescription advice. The next one's about a special office examination. So to just get advice, it was $250. To have a special office examination, it was $5 to $10. I like that night visits are twice as much. You get twice as much for a night visit. I think that's worth it. The other thing that I was curious about was the ordinary obstetrical cases. Now, how much would I get for a delivery back in 1850? Well, I would get between $25 and $50. So it doesn't sound like very much, but when you think that the average gold mine worker had to work all day and would only get about $3, this is a fair amount of money. So that's what it costs, and you can see all the doctors who were in the area signed off on it at the bottom. Next is a list of the physicians, and I include this because anybody who knows anything about Sacramento history can recognize some of these names. Some of these names are on streets or on buildings at Old Town. There's John F. Morse and Thomas Logan, probably two of the most prominent physicians in our area, and A.B. Nixon. And I also included because it shows the schools that they graduated from, and they're pretty impressive. There's a Harvard University doctor. There's somebody from University of Pennsylvania, which is probably still one of the best medical schools in the country. So they were well trained, and it was good to have them come together and to decide about how to help Sacramento. The main competition, or the other kind of physician that had some skill and expertise in our area, was that of the Chinese medicine doctor. And the story behind them is very interesting. The Chinese came over pretty much as the gold rush was evolving, because the the Chinese recruits came over, and they were put to work in the mines and to help to get gold out. They would often be recruited as a single province. The recruiters would go in, conscript or get some people to come on over. They would come over on ships across the Pacific. And usually they would bring with them their own Chinese medicine practitioner. So there was commonly a herbalist. That was somebody who knew about the medications and the things that you would give. And there was also the bone setter. Bone setter could kind of manipulate bones and that sort of thing. But also, if they had a broken bone, they could put it back in the right location. The Chinese medicine physician, the practice of Chinese medicine was elevated when, in 1862, then Governor Leland Stanford's wife suffered a very terrible sort of lung condition. And the herbalist, the Chinese medicine practitioner who was the herbalist, gave her a medication that gave her an herb that had ephedra in it. And ephedra was actually very important and helped to clear up the problem. So we do, as a result of having this be part of Sacramento medicine, have a very nice medicine case, Chinese medicine case. And on the outset, you can kind of see there's some models. There are a bunch of little devices called cupping. There's also some acupuncture instruments. And then there's all these boxes. And as you might anticipate, the boxes are the ones that held all the herbs. The boxes here, these were actually taken from ships that were providing passage for the Chinese medicine doctors, as well as the Chinese recruits. The next slide shows what's inside some of these boxes. And these are kind of interesting, so we'll spend a minute looking at them. First of all, there's all kinds of stuff. There's up in the upper left-hand corner, there's a cattail pollen. The bottom, you see, now what does it look like? Looks like rat poop. Well, it's flying squirrel feces. And that was used for abdominal pain, menstrual pain, and postpartum abdominal pain. My favorite one was actually the one in the upper right-hand corner, as you look at it, and that's a hornet's nest. And there's no hornets in there. This is actually a very useful medication, because the hornets, it was used for rashes or skin infections, that sort of thing. And it turns out that it actually has some antibacterial properties. And so therefore it was effective in helping people. Fortunately for everybody, the physicians, the patients, society, there was a lot of stuff going on in medicine during the last half of the 19th century. So from around 1860 to 1900, medicine was completely evolving and changing and growing. And it was mostly because the scientific method was now being touted and being used purposefully for all kinds of physical phenomena as well as medicine. And the first one of those things that happened was in 1860, Louis Pasteur figured out about germ theory. And he discovered that there were some unseen microbes, that's what he called it, that were responsible for infection. Knowing this and having some kind of a handle on this particular thing that infection could be prevented really was the turning point in society and in medicine to help us kind of figure out how could we treat it. So as a result of that, there was lots of anti-infection precautions. Surgical theaters were changed drastically. They started sterilizing instruments. They started washing their hands. They started adding this carbolic acid to an operating room that would kill bacteria. So they couldn't, that much then about antibiotics or antiviral medication. They were to learn it. It came of age during the last half of the 19th century and the early part of the 20th century. So they learned about it, but in the meantime, they could actually start practicing better medicine. We have this slide here. This is also taken from the museum. It's a famous slide. I have seen this one before. And it shows the very first time that anesthesia was used at Harvard Medical School. And so this was in 1847. I love this slide because it actually shows that real difficult transition that occurs when anything new or different kind of happens. And so what you can see is, first of all, there's a lot of guys in the room, right? Well, did anybody count them? I think there's 9. That's because you of 5 people just to hold the patient. Operations were painful, they were difficult, and so there was always 5 strong men who were required at every operation. There's also a person giving the anesthesia, and then there's a surgeon and his assistant, and then probably somebody kind of helping the assistant. But there's a lot of other things that are remarkable about this. There's no masks, right? No gloves. And wearing scrubs. Whatever they were wearing on outside. So I think there's somebody with a top hat and a morning coat there too. So things are different and things are better now. The anesthesia, it took a long time, even though it seems like it would be like really obvious, let's use anesthesia, that seems much better. It took like 30 or 40 years to actually get everybody to use anesthesia. We have in this case of anesthesia equipment at the Medical History Museum. We've got an old ether canister, and then there's an ether disc. The ether disc, that's just the cage. There was also having to be a cloth thing that had to go inside there, and then they would drop the ether into the cloth, and then the person would just go ahead and breathe that. That's how they would administer anesthesia. And if the person started to wake up, then they gave them the drop. What do you think they what? Yeah, that was a little bit of a problem. So ether and most early anesthetics were really useful. And it was kind of a push-pull thing because, by and large, you didn't necessarily need any electricity in the room, but then they started to use electricity to make things faster, and electricity brings with it the chance of a spark or other kinds of problems. Um, I'm going to go ahead and finish up on this last little bit of history that I think really shows you how Sacramento was really at the cutting edge of medicine. So that's the story of the X-ray. The X-ray was invented in Germany by William Lincoln in 1805. So that's when it was invented. And you can see this is the original setups that they had. There was a guy looking through this visor thing and watching to make sure that the X-rays went into the X-rays. They would be absorbed variably by the human body, so that's why you get to see, bones and skin and other things. And then on the back of it, the electrons from the X-ray would go ahead and excite a photographic plate. In order to get to generate the X-rays, you had to have electricity, but there wasn't any wall sockets then. So what they had to do is they had to get one of those electrostatic generators. They would manually make it go round and round to excite the piece of metal or whatever they used to get the X-ray to be generated. So it's kind of a big deal and expensive, and there's a lot to it. Well, there wasn't too much, so that Sacramento didn't to have that. So we have in our X-ray kits a bunch of examples of those early X-ray machines. We have and the ones that are kind of up on the right-hand side over there. They look like a flask with a thin neck on it. It was called a Crookes apparatus. We also have one of the electrostatic generators, but I don't think it's pictured here. So when did we get it? We got it in 1897. Okay, so remember, it was invented in 1895, and Dr. Fay purchased his X-ray machine in 1897. So not even 2 years after it was invented, we had it in Sacramento. And at the museum, there's actually a picture of Dr. Fay. He's a very distinguished gentleman with a huge handlebar mustache. And he's sitting behind his X-ray, very proud. He's got his electrostatic generator next to him, and he was basically X-raying people soon after the X-ray machine was made. And this also kind of lets on to like a news story. So why was Sacramento so up on it in 1897? Why did they even have it? Well, think about what was going on in Sacramento at the end of the 1890s. We were building railroads. Railroads are dangerous. People get hurt. They break bones. There's a lot of bad things that can happen with the railroads. And so there was actually money here building railroads, positions that could, recruit the best equipment, the finest equipment. There was a whole hospital system, the railroad hospital, that was primarily responsible for treating the people who had worked on the railroads. And so because there was money, there was a need, and there was infrastructure around that, we got an X-ray right away. So this is just one of the many stories. If you come to the Sacramento Medical History Museum, you'll be able to experience and just ask one of the docents if we're there what's behind this or what's behind that. And we usually know. If we don't know, sometimes make something up. All the docents are doctors, retired doctors, and you know how doctors never admit that they're wrong. All right, so that kind of concludes the formal part of my presentation, and at this time I'd be happy to entertain any questions or concerns that people have. Yes. Oh.
I think you ought to tell people a little bit about the iron lung because that.
I happen to have a slide. Oops, there it is. Hey, does anybody know what this is? George already gave it away. It's an iron lung. So, an iron lung, there's a lot to talk about it, but this is our best artifact, bar none. This is the only working iron lung that's in California. And it was refurbished by one of the docents, Dr. Bill Vetter. He's a retired cardiologist, and he loves to fix stuff. So he's taken a lot of our equipment and actually make it usable. So this is the iron lung, and basically it was an apparatus that was designed to breathe for somebody, but it doesn't use. Nowadays, you get intubated, you have a respirator. That's called positive pressure ventilation. This is the sort of the reverse of that. It's a negative pressure device, so that you put the person into the iron lung. The bellows here go back and forth. That reduces the pressure that's inside the solid canister, and the nose and the mouth are free so that the person can go ahead, and the pressure has to be equalized by the air and oxygen that's in the environment and goes into the person's lung. It was an elegant solution for what it was devised for. It was devised to help people with paralysis of the diaphragm. That was one of the really bad complications of polio. Polio, we got a vaccine in 55, and so if we get vaccinated, then we won't have polio.
Hi. I guess I'm really incredulous that a theory of the four humors was still dominant in 1850 from the Greeks, from the Middle Ages, because surely in 1800 years, we know there were many advances, and I mean, they were vaccinating people during the Revolutionary War. John Adams vaccinated his children. There was Florence Nightingale with new theories of, cleanliness and germs. And you see all those pictures from the Renaissance and 1700s of people stealing bodies from graveyards, to study the anatomy. So
it's all true. So we can deal with each of those little things that you talked about. But the prevailing thing about your observations is that there were things that people knew would make things better, but they did not have a theory or an understanding of why it happened. So the vaccinations that were pretty prominent for smallpox and that sort of thing, even in the 1700s, it was just that they knew that it worked. They didn't know why it worked. They had no clue. It would be something that was passed on from one person to another. When if you have an infection of a mild case of smallpox and you give that to somebody else, you might get immunity later on. But all of those observations are very good, very accurate, and very true. It's just that was the four humors. It had its detractors, believe you me, all throughout the late 1700s, early 1800s. But there wasn't any other comprehensive theory that was any better. And so that's why they kind of stuck to it. And Louis Pasteur was really the one who revolutionized thinking and made a big difference. When you kind of think about that, you also have to kind of think about, where are we now? So we still have germ theory as being a prominent theory. Okay, but there's a lot of things that germ theory doesn't understand or help, like cancer, and chronic diseases and illnesses like that. So I think we are primed, and this is one of the things that I kind of get from being a docent in the Medical History Museum is that I see how things kind of come and go, and I'm like, there's going to probably be something different on the horizon that's going to help us explain and take care of all of these people who've got these chronic illnesses. I really appreciate your observation. Thank you very much for it.
This was obviously all fee for service
Yes.
in the beginning.
Oh, well, no. If you want to talk about that, I got a story.
Insurance company. I mean, the current system is, very problematic, obviously.
If I had
Evolved.
a little bit more time, I would have told you about a brief history of the hospitals because it's a really important story that refers exactly to that. So it was mostly fee for service, certainly some of the fee schedules and that sort of thing. But what happened during the building of the railroads is that we did have a medical plan. So the employees of the railroad had to pay a certain amount of their salary every single year. They built up the railroad hospital, and I had some pictures of it. The railroad hospital, it was beautiful in 1878. It was built. So that was the only other form of insurance, and it worked really well. It worked while the railroads were being built, and then it kind of fell out of favor. But it was that was probably the idea Sidney Garfield used when he created Kaiser, the Kaiser prepaid medical plan. He was probably thinking back to that prepaid medical plan because it was very successful. Any other questions?
Right here. Would you know anything about the first female physician in Sacramento?
Yeah, I don't. Do you know? Okay. I do have a good story about a very early female physician. I don't know that she was the first one, but if you come to our museum, there's an entire room that's set up for a physician in the and the physician team that worked there was a husband and a wife. And we have the diplomas. The husband graduated from Northwestern. No, he graduated from Harvard Medical College, and his wife graduated from Northwestern University. And we have her diploma, and her date of graduation was 1897. Yeah, so that's a very early one. And then it's set up in their office, and you can kind of see what it would be like to practice medicine in the 1930s. And that's a whole nother story that I want you to see.
Okay. Right here. First, I want to say thank you for the presentation. It was great. I highly recommend going to that Medical History Museum. I went there last year, and there's a lot more to see than what you just saw. I was there almost 3 hours. So. I also want to mention that there's a pharmaceutical museum too in the Thomas area, and we went to that this year, and I think it goes very well hand in hand.
Okay. Oh, great. I didn't know about that. Thank you.
Yeah.
What was set up for treatment of people who couldn't afford the fees?
There was a county hospital, and that's another interesting story. So yeah, there was, of course, people that fall out of need some help. It's a county hospital, and actually, the county hospital it was one of the prominent hospitals in the late 1800s. The county hospital, though, what they did is, and it was set up on Stockton Boulevard. Okay, what's that Stockton Boulevard now? Davis, which actually has the county hospital right there. So that same area, that the county hospital, which was started back in 1870 something, it actually became UC Davis. They partnered with Sacramento County and 1900s, and now that's probably one of the best areas to get care in the United States.
So a couple of comments and questions about ether.
Yes.
My mother graduated from the Mass General in 1932
Okay.
and worked at the Mass General all throughout the 30s. And it was a serious occupational hazard for nurses. And one of her colleagues, the ether exploded or caught on fire, and she survived, but I mean lengthy treatments for burns. So I think it was an electrical spark, but I wondered, that was one of my questions.
Yeah.
The other was in 1950, I had to have my tonsils out, and I was administered ether, and my mother didn't want the hospital doing ether because they have to put a cone. By then it was a cone. And so I just wondered if anybody else had ether.
Well, I it looks like about 10, 15. I appreciate your comments about that. And it does illustrate one of my points, and that is that even though something is known to be, harmful and that there's better ways around it, it takes a long time for things to actually evolve and to change. Something as simple as washing your hands before an operation. That it was developed, that the whole experimentation and the system for doing that and the proof that that was helpful happened in 1 year. It was pretty late, as you might expect, somewhere around 1850. But it took 20 or 30 years for that to be established in the country.
Thank you very much, John. That was really interesting. And truly, he's right. If you have not been there, go. It is not a museum that you can run through in a half hour. It's got so much. So thank you so much for bringing all this information to us. And it's right here.